Welcome back to Mapping Healthcare on KDRT 95.7 FM in Davis, California, where a medic with a map explores healthcare around the world, highlights people who improve it, and shares what we can learn from them. This is your host, Dr. Sheikh. Let me tell you a quick story. A 7-year-old, let's call him Matteo, comes into a clinic for what looks like another routine asthma visit. The clinician talks about symptoms, inhalers, action plans, everything by the book. But Matteo was quiet. Just before they wrapped up, the clinician asked a different question. Matteo, what matters to you? The child looked up and said, I want to play soccer again. I don't want my mom to worry every time I run. And just like that, the visit changed. This wasn't just about lung function or medications anymore. It was about a kid who wanted to run and a parent who wanted to stop holding their breath. But how often do we miss that? In pediatrics, we're trained to track growth charts, prevent chronic diseases, and stay ahead of risk. But if we don't pause to ask what matters to people we take care of in healthcare and their caregivers, we risk caring for conditions instead of families. This episode of Mapping Healthcare is about that pause. About the simple, powerful question that turns a routine visit into a meaningful one. It's a move from asking, what's the matter with you? To asking, what matters to you? The term patient-centered care was coined back in 1988 by the Picker Institute. They realized that as medical science got more advanced, it was actually distancing physicians from their patients. We started treating diseases instead of human beings. In 2001, the Institute of Medicine named patient-centered care as a top priority, defining it as care that ensures patient values guide all clinical decisions. But the real viral moment happened in 2012, with an article in the New England Journal of Medicine written by Dr. Michael Barry and Susan Edgman-Levitin. They argued that when patients face fateful healthcare decisions like major surgery or lifelong medication, the clinician's job is to be a coach or a partner. They urge clinicians to ask, what matters to you? This idea caught fire. It was championed by the Institute for Healthcare Improvement and the Beryl Institute, and blossomed into an international movement. There's even a What Matters to You, or WMTY Day, that's recognized annually on the first Tuesday in June. But like many good ideas in healthcare, the real challenge is in awareness. It's practice. What happens when a movement meets the reality of busy clinics, overwhelmed clinicians, and systems that are built for efficiency more than listening? Today, we're joined by one of the authors of a paper exploring that question. How what matters to you moves from a campaign into the everyday work of clinical care. Dr. Christian von Plessen is an internist and pulmonologist at the University Center for General Medicine and Public Health in Lausanne, Switzerland. He's a senior advisor for healthcare quality and safety to the Health Authority of the Canton of Vaud in Switzerland. We talk about his work on the co-production of healthcare services using the What Matters to You framework. The views expressed on the show are mine and those of my guest. So Christian, welcome to Mapping Healthcare. So today we're talking a little bit about your work in co-production, specifically as it applies to the What Matters to You movement in healthcare. So that movement, it's an international initiative that encourages clinicians and healthcare staff to ask patients a simple but powerful question, what matters to you? Rather than focusing only on the usual question, what's the matter with you? So let's start at the beginning, Christian. What originally drew you to center your work on this question of what matters to you?
I think it was the beauty of the wordplay, to be honest. The difference, as you said, between what is the matter with you and what matters to you. I really liked that. That was very appealing. Then, to be honest, when I first heard about the campaign and everything that was connected to it, I kind of thought, well, do we really need that? I wasn't quite convinced, Then with a little bit more experience and a bit more time as a doctor in my nearly 30 years, I kind of realized, yes, we definitely do need that. So that's kind of how it kicked off for me.
Your work really is central to this question. The goal of the question is to make care more person-centered, patient-centered, meaning treatment decisions are guided not just by people's medical needs, but also their own values, their preferences, their life goals. And this really improves communication. It's shown to improve patient satisfaction, health outcomes. So, looking back in your work as a physician, a clinician, do you remember the first time you asked a patient what matters to you and you realized that it was different from other questions?
Yeah, I think I do. Perhaps not exactly that way, but so I was on call in internal medicine, pulmonology at a big university hospital in Norway. And there was this, no, it actually was in cardiology. And so I did my rotation cardio. There was this patient who came in the morning at 4 o'clock. That was when we still had paper files, and his file was about 1 meter high, a big block of paper, which was actually even difficult to carry to the emergency rooms. And he'd had about 85 admissions. He was very afraid. So there was this morning where I wasn't that tired at 4 in the morning. So I had a bit of kind of leeway, I thought, well, okay, I'll sit down and try to find out what's going on. So I didn't quite ask him what matters to him, but I kind of asked him, what's happening in your life? And he looked at me kind of astonished because I wasn't just putting on the nitro drip and, all that stuff because of the chest pain. And he said, well, my problem is I can't pee. So what happened is that this poor guy had prostate hyperplasia, and he had to self-catheterize. And with all the stress he's been through, I mean, just imagine 85 admissions, bad sleep, and so on and so on. He developed this tremor. And then especially during the night when he was even more fatigued, he couldn't get the catheter in. And then he got so stressed that he developed some chest pain because he did have some angina, but that wasn't his main problem. Actually, it was that. So we talked about that, and he said, well, I need to pee in the morning. It was as simple as that. But I can't. So then I call the ambulance because I get chest pain. And also he kind of realized that actually that was the main problem. And then I thought, okay, well, why can't you pee? And why hasn't that been treated? And he said, well, the urologist said, cardio doesn't allow me to get treatment for this because it's too risky. So this kind of unfolded as this story. And then finally, I mean, the risk assessment became very, very different after 85 admissions in another service. So all this kind of developed into a new discussion with the urologists and the cardiologists and anesthesiology. He was operated. So the question there, it wasn't exactly that. It wasn't so much about his values or what you might consider, but there and then for him, that was the problem. And for me, it was really an eye-opener because I thought, well, I have to know what's going on in people's lives to help them. And there's this wonderful colleague of mine when I still worked in Denmark, Morten Sodemann. He wrote a book about health for refugees and migrants. So he's a specialist in that field. And the title of the book is, and it's really been with me since, What You Don't Know Will Hurt the Patient. And that applies to many things, right? So in this case, it was that he couldn't pee, right? So it opens a whole kind of universe of things, but it can also be very, very concrete, very specific, and extremely useful.
The word you used, eye opener, I've seen that come up time and again when I've spoken to my trainees about using this question, because we start off with our assumptions about what people need, and just asking an open-ended question like this really changes our assumption for sure. And so let's talk about your paper that you've written on this topic here. So you're one of the authors of the paper, What Matters to You, From Campaign to Daily Practice, that was published in the peer-reviewed journal Swiss Medical Review in 2025. The paper looks at the journey from the What Matters to You movement, from a campaign to daily clinical practice. So why is that transition to using this question in daily clinical practice so hard in healthcare?
I think it's hard anyway. I think it's hard because, there are kind of different dynamics. So first, for a doctor, let's start there, or a healthcare professional, it takes quite a while to be up to the job, right? So it's like dancing. You learn the steps and you think 1, 2, 3, 1, 2, 3, 1, 2, 3, but you don't quite dance, but you still have to think 1, 2, 3. So if you add a 4, this consideration, for example, of that question or any approach to exploring the patient's context and values and so on, adds a 4 and you're already very busy learning the 3. So that's one thing. Then once you kind of get there and you have experience, and then comes this other dynamic that you kind of start thinking that you know what's going on and you develop some habits, and and then perhaps you're not that open anymore. So in the kind of the biography of a healthcare professional, obviously this is a development that you have to be very aware. Otherwise, I would think that if you look at how we work in healthcare, and if I look at my time in healthcare, it has actually become more busy and there is more pressure. But that's more recent. We didn't ask that question 20 years ago when I still thought healthcare was actually quite, it was tough sometimes, but it was a great job and it was quite relaxed also and so on. So that has changed a bit, but that's more recent. The other thing is that if you look at kind of the mechanisms that influence us in our work, they are very, very focused on doing things. But obviously, healthcare is not only about action, but it's also about relationships. But the remuneration and all that it's always about what you do, right? So all this kind of part that is more relational, you have to find a space for it yourself. And it's obviously also there where a lot of the satisfaction and the fun and the love of healthcare comes from. But it's not always easy in a system that kind of pushes you into more an action-oriented approach. And then one thing you said just before, perhaps more a way of how you learn. We all have assumptions about how things are, right? Or how people think, or what they think matters to them. Challenging assumptions is not always comfortable. So that might be another aspect. So it's not always intuitive to leave your comfort zone and then kind of enter into this space where you don't control anything. It's a risk also, psychologically speaking.
So lots of challenges to overcome before this kind of question is hardwired into the usual questions that healthcare professionals ask. But we are getting there. So the movement is often highlighted on the What Matters to You or the WMTY Day, and is used in hospitals, primary care, and long-term care settings to convey the importance of empathy, shared decision-making, and just more holistic care in general. There are organizations that have adopted these various movements that have come along in the healthcare improvement world over the last few decades. What's the difference between organizations that successfully embed what matters to you from those where it just kind of remains symbolic?
Well, the proof is always in the pudding. Or as Deming said, well, the definition of quality is actually done. It always comes from the customer. So the final difference, or the kind of the litmus test, is if you ask a patient, do they feel heard? Can they establish relationships that go beyond what is the matter, but include what matters to you? And that can be making decisions and care planning. And so I think that's the final thing. The other element, and that's also in our paper, and then if you, as an organization, are interested in what people say about what matters to them and what healthcare professionals and perhaps also patients say about how it was to ask that question, collecting those data, that can help you improve your organization. So you have to create a loop. You have to create these learning loops on different levels. So with all the three, the patient, the health professional, and then the organization that actually can use this interaction and with what comes out of it to learn as an organization. So that willingness, that readiness to do that, I think that is very important as kind of a condition to be able to advance as an organization, right? So we are doing this on the cantonal level, and those are colleagues from hospital, from ambulatory care, from nursing homes, from from home care, so a very diverse group that coordinates the campaign on the cantonal level, where we exchange about how we want to do it and what we want to do with the answers. And last year, for the first time, we had created a shared database so that everybody can put their data in that. So you can even go beyond institutions, right? So you have a more system approach by using it.
Yeah, and great point about collecting the data to see that a question like this makes a difference. When you think about positioning a movement like this to healthcare and hospital leaders, an important point, I think, is that when clinicians understand what matters to a person, to a patient, they're less likely to recommend unwanted or unnecessary intervention. So this ends up reducing things like medical errors or overtreatment and stress to patients. In terms of conveying that to hospital leaders who are worried about healthcare cost, that I think is an important point. Looking at all of the many things we need to do and get done in healthcare, how do you prevent the what matters to you question from becoming just another checkbox?
The question as such and the campaign as a mechanism to create some energy and some dynamic and, get going with this. Then when you think about how you can integrate that into your work as a healthcare professional and as an organization, it's not really about the question anymore. I mean, it's about how you develop relationships between a patient and a healthcare professional. And that is at the core of our professions. And sometimes it gets lost as a core organizational value, right? So integrating that in how the organization pictures itself and articulates itself is obviously one aspect that's very important. The other thing is the link to training. So especially in institutions where there's lots of health professional training going on, we train internists for primary care and so on, for example. I mean, this is a fantastic learning tool about communication, about relationship. We do role play, for example. So it becomes more and more important to integrate that in practice and how we learn to practice in your organization.
So, this question, what matters to you, as I see it, is important in many areas, but it's especially important for people with chronic conditions or end of life care. So, people with long term illnesses or nearing end of life often have complex priorities that we can't just make assumptions about. And this question helps ensure that our care aligns with dignity, with comfort, with their personal wishes, and not just clinical routine. So, did your research bring up some examples of where asking this question changed the clinician patient relationship in unexpected ways?
Yes, it does, and it actually does regularly. So we see that quite often. So one example is connected to this question of training of young doctors. So this is a situation where in the kind of the weekly meeting, we have some role play situations. And the young doctor had experienced a consultation that she found quite difficult. So she plays the doctor in that consultation, and one of her colleagues plays the patient. And what came out of this, when you observed this, was that there was a total mismatch of what the young doctor, as a doctor, was asking and what the young doctor who was playing the patient was thinking about. So they were just talking completely in different directions. So there was no real communication. And what had happened? Well, it was centered around a situation in the consultation where tensions rose, even some aggressivity. So really, the patient really got very annoyed. And this was triggered by kind of ticking boxes about preventive care. So we've checked your cholesterol, what about smoking, your weight is where, and so on and so on. So just the kind of the preventive care list, which is obviously very important for primary care. And the patient got more and more angry, and she couldn't, in that situation, figure out how to solve that. But in the role play, they kind of replayed. And what came out is actually, and she went then back to that patient in a second consultation. But what came out in the role play was that she actually did not at all know what mattered to that patient in that situation. So that had led to this conflict, which became pretty unpleasant, actually. And what had mattered to that patient was that his residence permit was about to expire in about 6 weeks, and he didn't know what to do about it. And this doctor was talking about, he was drowning and she was describing the water kind of. So, preventive care, if you can't stay and have to go back to a country where things are quite difficult, is obviously not aligned. So this kind of role play where suddenly but I haven't asked that person what really mattered to him. That really opened the door, because then she tried it in the next consultation and he said, well, I'm afraid. I don't know what to do. So he didn't need to talk about preventive care, but talk with a social worker and so on, right? So it was a totally different agenda. Sometimes you have it that extreme, not always that extreme.
Yeah, so Christian, you've convinced me this is a critical question to ask, and clinicians who consistently use the what matters to you approach often see improved trust, they see adherence, they see open communication. People are more likely to engage with you when they feel their goals are understood. So, did you encounter any resistance from people in the healthcare system when you were talking about this approach? And if so, where did it come from?
Well, not a lot, but quite some. So we've done it with doctors, with nurses, with nursing assistants, so quite diverse. This year we'll have a pharmacy also. So my experience is based on different health professionals. So one resistance is I don't dare ask that question because I might not be able to help the person with what really matters to him. So false promise or false hopes, That's one thing that actually comes up quite often. So that I think you have to take that as a serious problem, because oftentimes you can't really help people, which is what we see quite often, especially in primary care, right? So you can perhaps accompany but not really change anything, or in palliative care. That's one. The other kind of classic is obviously we don't have time. If you think of the situation with this gentleman who thought about his residence permit and the doctor who thought about preventive care, I mean, that was a waste of time, right? That was really a waste of time. So I don't quite buy that, because it can be time very well invested.
So, based on your findings from your work and your experience, tell us what conditions need to be in place in our healthcare system for this approach, the what matters to you approach, to thrive.
So obviously one of the conditions is that this has to become part of the way we do things, right? So that's a condition, but that's a long-term goal. Other conditions are obviously more kind of implementation factors also, such as role models. There could be simple things like more contextual, for example, when you go around, can you sit down next to the bed? Is there a chair, or can you find one easily? So those are more kind of practical things. Then the longer I work in healthcare, the more I think that Elizabeth Warren was right when she said you're either on the menu or on the table, right? And so that also applies to patients, I think. You need patients on the team to really kind of consistently remind and bring in and insist on the importance of that perspective, and also on the level of governance and in improvement projects, and design projects, and also on feedback on clinical processes and so on. So that's very important. And then at the point of time, you do need some data also, right? It's not easy to measure, obviously, but I mean, most healthcare institutions today do some kind of patient experience surveys or patient satisfaction surveys. So questions that can kind of check out this are actually there quite often already. They might be tweaked a bit or adapted a bit, but that would be helpful too.
So, Christian, that was a really important discussion. Lots to learn from there. You brought in really practical points that each of us can use in our clinical practice, and also things that people in our community can use when they go in to get care at healthcare systems. We end each episode of Mapping Healthcare by talking a little bit about the place our guest comes from. And you work in Lausanne, Switzerland, a beautiful part of the world. So tell us about a couple of experiences, activities that someone new to Lausanne should check out.
Yes, I would love to give you some ideas. So if you are in Lausanne, you look down on what people abroad call the Lake Geneva. In Lausanne, we don't call it that way, but it's called the Lac Léman. And you look over the lake, and then quite amazing because you look over to France, right? So France is on the other side of the lake, and there's Evian, where the famous mineral water comes from, and then after Evian, the mountains begin, and you see green mountains with a lot of forest. And then at the moment you get to the white tops, and it goes quite high up, actually. It goes up to 3,000 and plus meters. So high mountains. So it's extremely beautiful. So if you like hiking, a dream. If you like skiing, it's lovely, either cross country or downhill. So skiing is wonderful. There's this wonderful chocolate shop called Blondel that's been around for 150 years, a tiny shop, not changed at all. They make the most wonderful chocolate. And 140 vineyards right next to Lausanne. So it's a wonderful region. Also culturally very, very dense. Beautiful cathedral, massive thing crowning the town. So lots of stuff to see.
So that was Dr. Christian von Plessen telling us about how the What Matters to You question moves from an inspiring campaign into the everyday work of clinical care. This conversation isn't about slogans. It's about culture, power, and trust, and what healthcare quality really means when we measure what matters most. If you're a skeptic, you might be thinking, that sounds nice, but does it actually change anything? The answer is yes. Studies show that this shared decision-making, when we ask people what matters, leads to patients needing less emergency care, less medications. People often choose less invasive options like elective surgeries when they realize that those options don't align with their personal values. They deal with less pain and suffering and even end up living longer. This question is not just good for patients, it's good for clinicians too. It can help reduce burnout by giving healthcare staff a deeper sense of purpose and connection to the people they treat. It's not always easy though. On the one hand, you've got things that help, like adding this question to standard medical forms. But on the other hand, there are major hurdles. Time is a huge one. Healthcare environments are busy, and the question itself can be tough to ask. And for a patient, it can be really hard to answer, especially when they're put on the spot. One clinician said they were almost afraid to ask what matters to you, because what if they couldn't give the patient what they wanted? It shows you how vulnerable clinicians are too. So whether you're wearing the stethoscope or the hospital gown, here are 3 things to take away from the What Matters to You movement. First, asking the question is just the start. If you ask the question, but don't document the answer or change the care plan to reflect it, then what's the point? Change happens when the answer to what matters actually guides treatment. I experienced this myself when I had surgery for a broken ankle a few years ago. I shared with my surgeon and physical therapist that my goal was to hike in the mountains again. Their job wasn't to grant my every wish. It was to include my personal goals into my treatment plan. My road to recovery wasn't a walk in the park, but together we made it happen. Second, this question is especially powerful at medical crossroads, such as when a patient is facing a treatment with serious side effects or a screening test that could trigger a cascade of interventions. That's the moment to pause and ask about patient preference. What are the most important things to you that we should keep in mind as we decide? And finally, if you were sitting in your clinician's office and they turned to you, looked you in the eye and sincerely asked, what matters to you? Think about this. What would you say? Thanks for tuning in. This was your host, Dr. Sheikh. You were listening to Mapping Healthcare on KDRT 95.7 FM. Connect with the show on Instagram at Mapping Healthcare to share your thoughts and ideas for future episodes. You can hear Mapping Healthcare around the world anytime on kdrt.org and wherever you get your podcasts.